Have you ever considered that the routine actions you perform every day might serve as an indicator of your health? It turns out that a doctor's experienced eye can identify hidden problems simply by paying attention to certain aspects of personal hygiene in older adults. These seemingly harmless habits can signal the development of serious diseases that are creeping up unnoticed. The most alarming thing is that most older people don't even realize they're making these critical mistakes daily. In the next few minutes, we'll look at 7 common personal hygiene mistakes that immediately catch doctors' eyes during examinations of elderly patients. You will learn how correcting these seemingly minor oversights can drastically change your quality of life and even save it, yours or your loved ones. The information we're about to share is rarely found in educational programs, not often discussed during doctor's appointments, and hardly covered in popular health publications. Nevertheless, this knowledge can determine how your golden years will unfold in health and activity, or in a struggle with ailments that rob you of independence and dignity. Let me share the story of Harold, a 75-year-old retired engineer who was confident in his impeccable personal hygiene. Harold led an active life, participating in his local community, hitting the golf course twice a week, and proudly attending his grandchildren's baseball games. However, during a routine medical checkup, his doctor immediately spotted 3 serious errors in Harold's hygiene habits that indicated the development of a dangerous disease over several months, of which the patient himself was unaware. "I was completely in the dark," Harold later admitted. "I thought I was taking good care of myself. If my doctor hadn't noticed these seemingly minor hygiene issues, I might not be here to tell the story." Today, we'll analyze what these mistakes were so everyone can avoid a similar frightening. Experience, and most importantly, learn how to act correctly in such situations. Simple changes that can extend life, starting today. Mistake number 1: neglecting oral hygiene. When was the last time you carefully examined your toothbrush? Is it worn out? Do you brush your teeth thoroughly twice a day? And more importantly, are you aware that inadequate dental care isn't just bad breath or the risk of tooth loss? It is directly linked to the development of cardiovascular disease, stroke, and even dementia. Geriatric experts from Harvard Medical School have convincingly demonstrated that bacteria from untreated gum diseases can enter the bloodstream and cause life-threatening heart conditions. In fact, their research shows that older adults who neglect oral hygiene are 3 times more likely to suffer from cardiovascular disease than those who maintain proper dental care. Don't rely solely on the author's words. Let's look at a real-life example. Sylvia, a 68-year-old teacher from Oregon, faced a serious problem that started with seemingly minor gum bleeding. She ignored it for a long time, believing it was normal for her age. "I just thought it was inevitable with age," she recalls. However, during a routine checkup with a cardiologist, it was discovered that Sylvia had developed a dangerous inflammation of the heart valves. This was caused by bacteria from her mouth entering the bloodstream. Doctors warned that delaying treatment for just a few months could have led to irreversible heart damage. What steps should you take to prevent similar situations? First of all, carefully examine your toothbrush. If it's more than 3 months old or shows signs of wear, replace it immediately. Dentists recommend using an electric toothbrush, which, according to research from the University of Pennsylvania School of Dental Medicine, removes 62% more plaque compared to a regular toothbrush. Brush your teeth twice a day, spending at least 2 minutes each time. Use a timer to keep track of the time. Don't neglect dental floss, using it every evening. Regular visits to the dentist are also crucial, even if you have dentures. Pay attention to any signs of gum bleeding or swelling. These are not normal signs of aging, but signals from your body warning of potential problems. Don't ignore these signals for even a day. The second common mistake in self-care is infrequent washing and insufficient skin care. Ask yourself, how often do you shower or bathe? Be honest with yourself. Older people often reduce water procedures, but it is important to remember that the skin is the largest organ of the human body, and any changes in its condition can signal serious internal ailments even before other symptoms appear. Expert dermatologists from the famous Mayo Clinic warn that reducing the frequency of bathing in older people often hides the first signs of diseases such as diabetes, liver problems, and the cardiovascular system. The results of their clinical studies show that almost 40% of undiagnosed diseases in elderly patients could have been identified at an earlier stage if due attention had been paid to the condition of the skin. Let's recall the story of Clarence, a 77-year-old pensioner from Michigan who previously worked as a postman. Clarence believed that one bath a week was enough, especially in winter when his skin became dry. "I just didn't want to dry out my skin," he explained. However, when his attending physician noticed an unusual change in skin tone during a routine examination for another issue, a subsequent examination revealed an early stage of kidney disease. As it turned out, the change in color was not related to poor hygiene, but to the fact that infrequent washing hid an important symptom that could have been noticed much earlier. To maintain healthy and beautiful skin, experts recommend adhering to a certain regimen. In particular, it is necessary to establish a regular schedule of water procedures, including taking a shower or bath at least 3 times a week, even if a person is not engaged in active physical activity. At the same time, you should give preference to mild detergents without fragrances that do not violate the natural lipid balance of the skin. After bathing, while the skin is still slightly damp, it is recommended to apply a moisturizing cream to seal in moisture and prevent dryness. It is extremely important to regularly conduct a self-examination of the skin, paying attention to any deviations from the norm, changes in color, texture, or sensitivity. The appearance of dry, flaky areas, unusual pigmentation, or areas of constant itching may signal more serious internal problems. In such cases, you should not postpone a visit to the doctor to timely identify and eliminate possible risks. Another important aspect of maintaining health is nail care. Doctors often pay attention to the condition of the nails, as they can reflect the general condition of the body. Changes in the color, shape, or structure of the nail plate may indicate the presence of various diseases, including anemia, thyroid problems, and cardiovascular disorders. According to studies by the American Academy of Dermatology, nail abnormalities in patients over 65 years of age led to the diagnosis of previously undetected internal diseases in almost 30% of cases. Here is the instructive story of Beatrice. At 82, she did not pay much attention to the changes happening to her toenails. Yellowing and thickening of the nail plates did not cause her alarm. She simply refused to wear open shoes, preferring to hide her feet from prying eyes. "I thought it was an inevitable attribute of old age," she later admitted. However, when the pain in her leg still forced her to see a specialist, the orthopedist immediately diagnosed a fungal infection. The disease had progressed for so long that it became clear evidence of a serious weakening of the immune system. Further examination revealed a hidden disease requiring immediate intervention. What steps should be taken to avoid such a fate? Doctors recommend regularly trimming your nails, giving them a straight shape with a slight rounding at the edges to prevent ingrowth. It is important to keep your nails clean and dry, wear breathable shoes, and change your socks daily. And most importantly, never ignore changes in the color, structure, or thickness of the nail plates. These are not just cosmetic defects, but potential alarm signals that the body sends. Fragility, discoloration, thickening of nails. All this is not an inevitable companion of aging. This is your body's attempt to convey important information to you. Are you ready to listen to these signals before it's too late? The fourth gross mistake in matters of intimate hygiene is neglecting adequate treatment of incontinence, a problem that strikes with its prevalence and the desire of people to hide it. According to statistics, more than half of older people face various forms of incontinence, preferring to suffer in silence instead of seeking qualified medical help. Urologists from the esteemed Johns Hopkins Medical Center are raising alarms, stating that ignoring incontinence can lead to serious skin infections, an increased risk of falls, social isolation, and, most alarmingly, can mask severe conditions like bladder or prostate cancer. Research indicates that timely and appropriate treatment of incontinence in older adults reduces the risk of complications by as much as 60% compared to those who try to hide the problem. For instance, consider the story of Douglas, a 73-year-old retired accountant from Arizona. Embarrassed to admit his sensitive issue to a doctor, he attempted to manage his incontinence independently, using paper towels and frequently changing clothes. Unfortunately, when he finally sought help due to painful sores, doctors diagnosed advanced prostate disease that could have been successfully treated in its early stages. "My pride almost cost me my life," Douglas bitterly admitted, regretting that he hadn't consulted a doctor at the first sign of symptoms instead of trying to conceal the problem. When faced with incontinence, it is crucial not to keep it a secret, but to discuss it openly with your healthcare provider. Specialists deal with similar cases daily and can provide qualified assistance. Prioritize specialized absorbent products designed for incontinence rather than resorting to makeshift materials. Regularly changing hygiene products as they become wet and diligently following cleansing protocols can help prevent skin irritation and damage. It's important to recognize that incontinence is not an inevitable part of aging, but often a signal that medical attention is needed. If you experience occasional episodes of incontinence, plan your outings based on restroom locations, or use homemade protection. Don't delay seeing a doctor. Your health and quality of life may depend on seeking timely medical care. Another common mistake made by older adults is improper ear hygiene. Ask yourself, how often and how do you clean your ears? If you use cotton swabs, inserting them deep into the ear canal, you are performing a potentially dangerous action. Improper ear cleaning can lead to hearing damage and missed signs of a serious infection. According to otolaryngologists, incorrect ear hygiene is the cause of nearly 40% of ear canal injuries in patients over 65, often leading to infections that could have been avoided. Imagine the story of Patricia, a 71-year-old former librarian from Washington, whose habit of using cotton swabs to clean her ears led to unfortunate consequences. She regularly inserted cotton swabs deep into her ear canal until she punctured her eardrum one day. This resulted in a severe infection that affected the surrounding tissues. "I always cleaned my ears this way, and no one warned me about the danger," Patricia recalls bitterly. She required emergency medical attention, but unfortunately suffered irreversible hearing damage that could have been prevented. So, what is the correct approach to ear hygiene? Remember a simple but important rule. Don't insert anything into your ear canal that is smaller than your elbow. Clean only the outer part of the ear with a warm, damp cloth. If you experience excess earwax, use special eardrops to soften it, strictly following the instructions on the package. And seek immediate medical attention if you experience pain, discharge, or changes in hearing. If your ears itch, feel clogged or full, or if you notice unexplained changes in hearing, do not try to solve these problems on your own. They require professional medical care. Hearing is a priceless gift, and it must be protected with proper care. Inadequate foot care is mistake number 6. When was the last time you carefully examined your own feet, paying attention to every area of skin between your toes, the condition of your heels, and the soles of your feet? Feet can provide important information about the condition of the circulatory and nervous systems, which is why doctors pay close attention to them when examining older patients. According to podiatrists specializing in geriatrics, foot hygiene problems are often the first signs of developing conditions such as diabetes, neuropathy, and vascular diseases. Studies show that in patients over 65, proper foot care and regular checkups can prevent up to 85% of amputations caused by diabetes. And that's not a mistake. In 85% of cases, amputations can be avoided with proper attention to foot health. For example, consider the story of Raymond, a 76-year-old retiree from Illinois. He had long ignored dry skin and minor cuts on his feet, considering them inevitable signs of aging. "My feet always looked rough," he said. However, during a routine medical exam, the doctor noticed the condition of his feet and immediately ordered tests for diabetes. The diagnosis was confirmed at an early stage when lifestyle changes could still significantly impact the course of the disease. "If the doctor hadn't examined my feet, I could have been unaware of my diabetes for years," Raymond shared. "And by the time the disease was discovered, the damage could have been irreversible." From that day forward, it's important to make daily foot care a habit. It is crucial to wash and dry them thoroughly, paying particular attention to the spaces between the toes, a favorite breeding ground for fungal infections. Regular inspection will help detect cuts, ulcers, changes in skin color, or temperature in a timely manner. Wearing clean, dry socks made of natural or moisture-wicking materials also plays an important role in maintaining foot health. Moisturizing creams should be applied to dry skin areas, avoiding the area between the toes. Do not neglect pain, numbness, or non-healing wounds. These are reasons to seek immediate medical attention. Dry, cracked feet, non-healing cuts, unusual skin color changes, or loss of sensation can be early signs of serious conditions requiring immediate intervention. These are not just cosmetic flaws, but potential warning signals. Another common problem is the impact of medications on hygiene. When taking multiple medications, you should pay attention to changes in body odor, the nature of sweating, or the appearance of dry mouth. Medications that support the body's vital functions can cause side effects that manifest as changes in hygiene, which may indicate their toxicity. Pharmacological studies show that some commonly prescribed drugs cause dry mouth, excessive sweating, or changes in body odor, indicating potential toxicity. According to research, nearly 40% of adverse drug reactions in older adults first manifest as changes in personal hygiene before more serious symptoms appear. The story of Barbara, a 67-year-old retired nurse from sunny Florida, serves as a cautionary tale for anyone taking medication. At first, loved ones attributed Barbara's peculiar body odor to poor hygiene until an experienced geriatrician recognized it as an ominous sign of toxic effects of medications that were gradually destroying her liver. "I took great care of my hygiene, showered regularly, and used deodorant," Barbara recalls, emphasizing that she never imagined the source of the problem was deep inside her body, not a lack of hygiene. So how do you protect yourself from such a situation? First of all, you need to carefully monitor any changes in your body after starting new medications. It is recommended to keep a simple diary in which you should record any deviations, whether it is a change in body odor, the intensity of sweating, a feeling of dry mouth, or changes in skin condition. It is important to maintain a sufficient level of hydration in the body, drinking enough fluids, unless otherwise instructed by your doctor. If you experience unusual sweating or a change in body odor, you should immediately consult a doctor, as this may indicate a dangerous interaction of medications. Under no circumstances should you independently adjust the dosage of medications, even if it seems that they are the cause of hygiene problems. Such decisions should be made only under the strict supervision of a medical specialist. If you notice an unusual body odor despite regular washing, excessive sweating, or severe dry mouth, do not attribute these changes to natural aging processes. They may be a warning sign of potentially life-threatening consequences of taking medications, requiring immediate medical intervention. Doctors, when examining elderly patients, often encounter 7 typical omissions in hygienic care. By knowing about these mistakes and taking timely measures to eliminate them, you can not only avoid serious health problems, but also preserve your sense of dignity and independence, and possibly extend your years of life. It is important to understand that hygiene is not just a matter of appearance or compliance with social norms, it is an integral part of maintaining health in old age. Implementing these simple changes in everyday life can have a significant impact on overall well-being and longevity.